Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for our fall series for coverage year 2024. Today's webinar is Plan Selection Strategies for Efficient Enrollment. I'm Ayasat Odiale, the Health Projects Assistant at the Center on Budget and Policy Priorities, and I'll be moderating today's webinar. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center on Budget and Policy Priorities is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and while we do hope you will learn a lot, we are not able to offer continuing education credit for our webinars at this time. Automated captions have been enabled for this webinar. To view them, you can click on either the More option with 3 dots at the bottom of your screen, or you should see 2 CCs icon at the bottom of your screen to turn on closed captioning. All participants are muted and in listen-only mode, but if you'd like to ask a question, you can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A during the presentation. We may not be able to answer every question, but we will have a record of all of your questions and we'll use them as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. A quick reminder that you won't be able to click on your screen to go to any of the links shared in the deck, but I will put a link to the slides in the chat where you can find all active links to everything shared. And after today's webinar, we will email a recording of the presentation along with links to the slides and other resources. And we will post everything to the Beyond the Basics website. So here you can see the schedule of our webinars in the fall series. Coming up on Thursday, we'll cover the annual renewal process on healthcare.gov. A week from today, we have the second part of our webinar on eligibility and outreach and application issues for people who are immigrants. And finally, we'll close out our webinars in English with Tying It All Together on October 24th and our webinar in Spanish on October 26th. We're excited to be celebrating 10 years of marketplace coverage as a part of our series this year. And as a part of the celebration each year, we will be spotlighting veteran assisters from around the country. Today's webinar will cover new and existing plan selection tools, narrowing the options, and navigating networks. Today's presenter is Arianna Anaya. Arianna previously served as a certified application counselor, community health worker, and navigator in Texas and Illinois between 2014 and 2022. And she's been presenting for Beyond the Basics since 2021. Now I'll turn it over to Jenny for our anniversary segment and to get us started.
Great. Thanks so much, Ayasat, and welcome back, everyone. I hope you're enjoying these brief vignettes of folks from your community. We have really enjoyed reading about them and learning more and seeing the faces of some of you all who are part of our audience. So today we're featuring Pam Gray, who's a senior navigator from the Center for Family Services in New Jersey. And she's been providing enrollment assistance since the marketplaces started. Pam was nominated by her colleague and former mentee, Lynn Perlmutter, who told us that Pam is always seeking out new avenues of training to stay on the cutting edge of Get Covered New Jersey rules, processes, procedures, and alas, quirks. Don't we all know about the quirks of our various marketplace websites? She's partnered with a variety of health and social services organizations and has maintained these relationships over many years. She's the key go-to person for health coverage issues from New Jersey Congressman Andy Kim's office. She's dedicated to the people she assists who come back to her every year, knowing that they'll get current, expert, unbiased counseling. Pam is also a mentor to other assisters at the Center for Family Services Navigator Exchange Program. She's a warm and caring person who really listens to the people she serves, lowering their anxiety level with her clear explanations. Maybe we should invite Pam to give some clear explanations at a Beyond the Basics webinar in the future. Pam says, at the Center for Family Services, we believe that the ability of a person to lead a fulfilled life starts with good health. Once they can see a doctor and get their needs addressed, it's like a weight has been lifted from their shoulders. Just being able to get yearly checkups and know that you're healthy or can get the daily medication you need to maintain your blood pressure or diabetes is life affirming. The saying that knowledge is power is so true when it comes to knowing what's going on with your health. Pam, thank you so much for your service to your community, and it's been a pleasure to feature you this afternoon. With that, I will turn it over to Arianna to dive right in.
All right, thank you so much. Okay, it's always such an honor to be part of any kind of training and webinar series. And I just want to thank all the assisters out there for all the amazing, marvelous work that you guys have done and will do this upcoming season. Don't forget about self-care. It's very easy to. So we're going to talk briefly, just to start, about a couple of tools that crop up in the plan selection section. Once you have taken your client through the application and you are actually starting to take a look at all the different plans available through the shopping tool. So these aren't going to be startlingly new tools. You guys have seen these and perhaps even heard me talk about them before, but just to kind of ensure that we're on the same page for some of the ways that they can be useful or ways in which they have been tweaked a little bit on healthcare.gov. So firstly, there's been a bit of an update to healthcare.gov's plan display. This happened, I want to say, towards the end of the summer. So you've probably noted that this standard display, what you're looking at currently, has been tweaked just a little bit. So this is a screenshot of how we had grown accustomed to looking at it. And then this is going to be how a plan is being displayed currently. So the big things to pay attention to, I would say, is how the title and sort of those factors that give you more information on the plan have been written out more of a list rather than stacked as they were in the previous display. The premium is still kind of the most prominent piece of financial information, but with the new display, it's been lined up with the deductible and the out-of-pocket max. And then the co-pays or co-insurance associated with certain services has actually been hidden in this new display, which has kind of a downside and potentially has an upside, which we'll talk about a little bit more when we get to the plan education part. Something to be aware of is that healthcare.gov is starting to indicate within the deductible whether or not the deductible is for health, drug, or combined. So this is helpful. This hasn't always been the case. And hopefully you will start to notice this next season that it will specify whether that deductible, as is laid out here, is a health and drug deductible combined, or whether it's separated into those two categories. So if we pivot to what the new screen will look like, so you've completed your conversation with the client, you've gone through those initial enrollment checklist questions, and you're looking at plans, it will look just a teeny bit different. Once we zoom into a given plan, we can see here right away that the PCP specialist and drug copays that used to be displayed right underneath the deductible and out of pocket are actually hidden, which in theory, if you're looking through plans quickly, could save you a little time if you're scrolling through. But when you're providing education, it might mean you have to do an extra click to display that information. So clicking on that plus sign will pull open that information. And one benefit here is there is more information displayed. It used to, again, be the primary specialist, generic meds, and I want to say that emergency room had been showing up as well, but this includes urgent care and also outpatient mental health. So these are the values that are now displayed, but in a hidden kind of way, as it were. I wanted to again call attention to this being another example of a deductible, and the breakdown here. Apologies that my box has actually hidden some of it, but health is 0, drug is 3,500, though it does specify extra deductible for some services. Again, apologies that my box has gone through that. In essence, this is kind of the alternative way that you will see deductibles displayed going forward, where one of the two categories is what the deductible is going to be applied to versus combined. This is kind of a good hint that extra deductible for some services, that you probably do want to take a look at the summary of benefits if you are looking at this plan for a client, simply because they're just saying that the 3,500 is applied to drug is clearly not the full story. There's clearly a little bit more, as indicated in the fact that we have outpatient mental health listed as a coinsurance after deductible and emergency room. So it starts to give you kind of a fuller sense of the plan, but it does encourage you towards double checking the summary of benefits. There is still the estimated total yearly cost has kind of been swapped from the right side of the screen to appearing between the premium and deductible. My understanding is that CMS is going to automatically use the medium use column, so there will usually be a value within this column. I would remind you all that you might want to consider changing from the medium use to the expect high use if you wish, because that will give the client a sense of sort of the worst case scenario in a given plan. It'll calculate all premiums for the year plus the out of pocket max. Whereas the medium use, just to pull up an example, might be a little hard to square in terms of how exactly do they get medium use here? What does that 1,000th? I mean, presumably, I don't even want to guesstimate, but this is a hard estimate to explain to a consumer, but the worst case scenario is not. Finally, something that I believe we had made mention for a couple of seasons now, if you have more than one enrollee trying to sign up or more than one person on a given plan, it's going to show the family total for both the deductible and the out-of-pocket max. So be aware of that. If you're looking for that individual total, easiest way to get to that generally is going to be that more information key, which will give you that breakdown for what it is per individual. But typically, it's going to be half of whatever you're seeing listed as the family total. There are exceptions to that, and the best way to triple check that is to look into more plan information just to be certain. Okay, the next area I wanted to cover real quick was to talk about easy pricing plans. So, of course, easy pricing plans are not new for 2024. They came into being last year, 2023. I think, though, that we've really started to get a sense of how beneficial they can be, especially for assisters and clients who are dealing with what is called choice overwhelm, where markets and numbers of plans are so big that just the mere activity of walking someone through their options can be a very, very lengthy and overwhelming process. So the idea briefly with an easy pricing plan is that they are standardized when it comes to their cost sharing. So the out-of-pocket max, deductible, co-pays, and co-insurance tend to be the same for standardized easy pricing plans. Each company offering plans on a given marketplace must offer one of these. So in each metal category in which they are offering plans. So this means that if you have 5 companies offering plans, you will have 5 silver plans that are essentially identical within the silver category. This can be very, very helpful, and we'll talk a little bit more why. I love technology. There we go. So These standards are set by the US Department of Health and Human Services. And Jenny somehow found the 2024 ones. I don't know where I was looking because I only found 2023. But basically, what this means is if we're looking at someone whose income puts them eligible for cost sharing reductions at 87%, this means that they're going to have plans with a deductible of 700 and an out-of-pocket max of 3,000. So every standardized silver plan for that specific income individual will have these same values. Thus, if you explain that plan to your client, you've explained every other standardized plan in the silver category to them because they must share these same parameters. Okay. To give example, I can't, of course, give an example, unfortunately, of the 2024 standardized plan, but this is an example of the 87% cost sharing reduction standardized plan for a 35-year-old single female with an income of $25,000 in Milwaukee. So you can kind of see the premium, of course, is not relevant, but the deductible, out of pocket, and copay amounts would all be standard for this person when it comes to silver plans. All right. So we're going to talk now about an approach to providing plan education and how the filter tool, but also easy pricing plans can assist someone with, can assist an assister with swiftly going through the options with a client. So firstly, I probably start to sound like an open record, like a broken record with this, but I cannot stress enough that the filter tool is so useful. I remember when I started assisting and I would get to the screen and just start kind of haplessly scrolling through plans because where do you start, right? It's just this endless, massive list of information. And the filter tool is really a wonderful way to start. So you can see right off the bat, there are two locations where the total number of plans this person is eligible for are laid out directly underneath the filter tool. And then to the right, under the lowest premium, lowest deductible sort function. So sometimes starting by telling the client, so you are eligible for this many plans can be helpful, but it can also freak them out for a variety of reasons. But next, going immediately to the filter tool to kind of give them an overview of those 224 plans immediately makes this choice overwhelm much more manageable. So the filter tool looks a little like this. Initially, I think quite overwhelming until you get a little accustomed to where things are. And I would say immediately off the bat, there's certain categories that are very, very helpful to you, the assister. So the first two, so you know right off the bat whether plans are going to be available to this client in platinum, bronze, gold, silver. In some markets, there are not platinum plans. In some markets, there's an extra category of bronze plans. So this kind of gives you a sense, but also gives you the opportunity to give your client a brief overview of these weird categories because they are kind of strange. I don't know why we went for Olympic medals as a mode of categorizing different plans, but we did. So sometimes this is a moment in which you could explain to the client you're eligible for extra savings in the silver plan, and you get that helpful little reminder actually in the filter if they are. Likewise, the types of plans that are available within this market is also going to be communicated in the filter. So there are 4 different types of plans available, well, generally when it comes to health insurance. But with this specific market, I want to say this is Miami, Florida, it's EPOs and HMOs. So if you had a client who'd said to you, well, I want a PPO, I want a PPO right off the bat, you could let them know, well, just so you know, in this market, PPOs are actually not available. You can give them that information now, as opposed to scrolling and scrolling and scrolling, which will exhaust and probably not inspire a lot of confidence from either of you. The other part that I think is useful, although perhaps more useful to you than for the client right off the bat, is going to be the list of different insurance companies that are represented in your market. So if you pull open that box, depending, of course, on your market, this is not the complete list of insurers in Miami, but it will give you a list. And this can be helpful right off the bat as well if the client is looking for or hoping to avoid a certain insurance company. You can kind of take a look at the number of insurance plans available through that company, but also just to see if there's anything familiar on this list for the client. So this means that before you even do anything, you know that this client is eligible for 224 plans. You know the number of bronze, silver, gold, and platinum plans. You know the types of plans that are available to this person. And you also know the health insurance companies represented in this market, as well as, if you really want to be nerdy, the total number of plans offered by each company within this market, which again, depending on what level of investigative insurance assister you are, might be helpful or might be irrelevant. But this is an incredible amount of information to have within minutes of sitting down with the shopping tool and starting that plan education part. I always try and pull this up, though I think it's one of my silliest charts because all it says is definitions that are kind of hypothetical. The definition of an HMO is very specific, usually. However, more and more, and we'll come back to this a bit later on, I've noticed in states all across the United States that HMOs are not requiring clients to have a PCP, nor are they requiring clients to get a referral to see a specialist. And that used to be how one would define an HMO. So this list is intended to kind of acquaint us with the general rules of what insurance plan types are usually going to mean. But the trick here is really, really understanding that there's a reason this is confusing, and it's primarily that these things are malleable. Again, the biggest one we've seen in recent years is HMOs kind of becoming surprisingly more flexible and functioning a little bit more along the lines of EPOs. So be aware of that. Be aware as well, PPOs and POSs are sometimes what consumers have heard good things about. And they certainly do offer a little more flexibility in that, generally they may have a larger network of providers. And also they tend to offer the option for a client to go out of network. But what clients don't necessarily understand is that going out of network, even with a PPO or a POS, means you are going through an out of network deductible and out of network out of pocket max. So that means that, well, it depends on the plan, but it often is not an affordable option for a client, even when they think it is. A separate deductible for separate care is going to mean you are essentially putting your contributions in two places at once, and it tends to be relatively unaffordable. So be aware of that a PPO isn't necessarily the be all end all solution for all consumers. Make sure they understand these definitions. Okay, so back to our handy dandy filter tool. Since the invention or the addition of these easy pricing plans, you could, of course, use the filter tool to search by a metal type as well as by any other factor you so choose. But if you select a metal category, it will give you the additional option to search for easy pricing plans within that metal category. So based on that, a recommendation, we've at previous points in time, it's been a recommendation to provide a client with plan education using the least expensive or second to least expensive silver plan. So going forward, it's always going to be a good idea to start, of course, with that filter tool, filter for the least expensive option, but as available, using the least expensive, easy pricing option as your plan for plan education is going to be exceedingly beneficial to you and to the client for a variety of reasons. It gives you the opportunity to become quite familiar with a set of plans, and it's going to mean that the client is going to understand not just the one plan, but multiple plans on the marketplace. So so here we have another example. I want to say this is another Milwaukee plan. Again, this is for 2023, not 2024. If I use this plan to explain deductible, out-of-pocket max, and copays to the client, and this is the standard plan, which I know because it says easy pricing up in the headline, I've effectively not just explained this one plan, but every other silver plan with that easy pricing. So this is great. Now, if the client doesn't want to go with Aetna because they don't have their doctor in network, but otherwise likes this plan, I can pivot to another easy pricing plan that does have their doctor in network. So it kind of gives you a little bit more flexibility. All right. So I always like to give an example of how I proceed when it comes to providing planned health education. We all have our own ways of doing this. I think as you do more and more enrollments and assist more and more people, you may adjust your educational tactics or, alter them based on what the client's telling you, etc. But I just like to kind of share what I tend to start with. But one thing I really do value about this new plan display is that it has a kind of clockwork order to describing the plan when you're looking at them individually. So here I'm recommending that you start with the premium, dance to the deductible, and then kind of end with the out-of-pocket max, because there is a logic that follows, right? Pay your premium, meet your deductible, stop paying once you meet your out-of-pocket max. Although please don't explain it like that. Rather, I'm going to give you guys my more detailed scripts. Again, the premium is what you pay each month. I always recommend, especially if you're working with individuals who are less familiar with premiums, which would be a lot of people these days, make sure they understand that the premium does need to get paid regardless of whether or not they use the plan. We've seen that be an issue for people. Sometimes with young invincibles specifically, I tell them it's a lot like their cell phone bill, although I don't know that they could imagine not using their cell phone bill, so maybe that doesn't work. But gym membership is sometimes another good way because lots of people are familiar with paying for a gym membership and not using it. I know I am. Deductible, again, I always like to emphasize when I explain the deductible that you do actually get certain services prior to the deductible. I hate to tell clients, you don't get anything paid until you meet your deductible, primarily because that's simply not true, regardless of whether they're enrolled in a catastrophic plan or not. There usually are some services, they might be pretty limited, but there's usually something that they can get before they have to meet their deductible. And so often I see the definition of deductible as what you pay before the insurance pays anything. And that's simply not totally correct. So to introduce what copays are here is not the worst thing. That there are some things that you pay a flat rate for, but for others, you're going to have to pay full price until you've met your deductible. And then finally, the out-of-pocket max as that worst case scenario number, that once your total contributions, and again, this means everything that's been contributed to the deductible is simultaneously contributing to the out-of-pocket max. At this point, the health insurance is on the hook for any future further care costs. Now, make sure you let them know as well that this presumes they're availing themselves of covered services. You can't hit your max and then go have like cosmetic surgery. That doesn't work. You can't hit your max and then start going out of network. That doesn't work. You have to continue to follow the rules of the plan. And of course, most importantly, you must continue to pay your premiums. So this is kind of my starter kit for plan education. And now at this point, moving forward, again, we're kind of working clockwork. You would explain the copays. It depends on you, I think, what your style is. I like to emphasize primary, specialty, and generic just because I'm accustomed to that. But I also like that they now list outpatient mental health as one of the kind of regular specified services. So if I were doing enrollments this season, I might be tempted to work that into my little health education spiel, simply because sometimes I work with clients who are too embarrassed to ask about mental health. And I don't bring it up because I don't want to bring up anything they don't bring up. So that might be an idea, but letting them know which services require them to meet their deductible and which don't helps them understand the logic of this plan in a fuller way. And of course, not just this plan, but all other easy pricing plans in the silver category. It is super helpful, I think, that there's at least one coverage category that has a co-insurance. So you can be specific with the client about how that is different from a copay. So I like to actually use an example, and I've in previous years used some of my own health disasters, but I found that that makes the client very nervous for me, which doesn't really, it's not conducive to the best enrollment situation. So I think it's easier to use a more theoretical scenario. So my scenario is listed out here that, let's say I have a $10,000 ER visit, which a lot of clients will scoff at because they may not be accustomed to what an ER visit may cost. And then I can be very specific about the math of this. So the logic, of course, is deductible first, and then I have a 30% coinsurance post deductible for an ER visit. So you deduct that 800 from the 10 grand, figure out what 30% of 9,200 is, and then you do that math to kind of figure out what the total bill is. Hopefully, ideally, the bill is such where you can point out to them that because they have this out-of-pocket max limit, rather than paying, whatever that full ER bill would have been, their costs are capped at the out-of-pocket max. So having a standard scenario of this nature to kind of, you've told them, right? You've given them a sense of the terminology and the functionality of this plan. Now you're really showing them and letting the logic of how health insurance works with this specific plan shine through. And then you can again end reiterating this all important point about the out of pocket max, right? How it's this kind of financial protection that is so important, but also that, there are rules and the client has responsibilities when it comes to that plan. Okay. So just to kind of hit a couple of reminder points, always when I've managed my own enrollment program, and prior to that, actually, the emphasis has been start with silver when it comes to plan education. And of course, the logic here is you're between bronze, you're between gold. If the client's looking for, depending, of course, on their income, which makes this tricky, but if the client is looking to pay more and receive more upfront, they probably want to look at gold after you explain silver. But if they're looking at a silver plan and say something to you like, I'm just worried about the emergency, I'm not thinking about getting regular care, a high deductible isn't a problem, then you can kind of logically take them down to bronze if a lower premium is what's important to them. But again, silver is a good place to start as that midpoint, but also because so many of our clients are eligible for cost sharing reductions. So you sort of naturally show them not just their premium tax credit, but also what they're eligible for when it comes to the reductions in the cost of care. Again, we have this updated ability now to teach clients about more than one plan at the same time, which just actually makes me feel happier as I say it. That hasn't been the case. This is really an incredible opportunity what these standardized plans give us. And I wanted to add that I'm, of course, using healthcare.gov to illustrate this, but we had this summer looked at different states and their standardized plan options. So that rule still applies because the standardized plans across the board, with 3 exceptions listed on that document from earlier, will all have those same parameters. So the logic of using that specific plan type and it serving as a kind of bridge to talk about other standardized plans holds through whether you're on the marketplace or whether you're on a state-based exchange. Okay, so a question I always kind of forget about for some reason is, how do you know when a client should look at a gold or a platinum plan, right? We've, silver loading, we've heard silver, cost sharing reductions, right? As much as possible, we want to show clients silver plans because it tends to be the best value for most of our clients, etc. But there are still gold and platinum plans. So the question kind of becomes, when do we need to think about this? When do we want to steer clients in that direction? And of course, when I say steer clients in that direction, they should be steering, we should be guiding, right? But there are moments where a client looking at a gold plan, if they're eligible for a certain amount of cost sharing reductions in a silver plan, makes no sense, right? And us saying that to them is just a matter of dollars and cents. It's not a matter of us doing anything untrue or unfair. That's being honest. That's part of our job, to help them understand their eligibility. So firstly, what you're looking at now is the FPL chart for 2024. It's kind of the version I like to rely on and keep updated. Essentially, if you're looking at the far left column, that's the number of people in the household. So a household of one, 100% of the federal poverty level is 14,580, whereas 400% of the federal poverty level would be 58,320. So I've broken this up historically this way to ensure that assisters see what the difference is when it comes to eligibility for cost sharing. So if I'm in a single household and I estimate my income at 21,870, I'm eligible for a lot more cost sharing than I would be if I estimated, oops, I'm going to go back to that. I apologize. I'm going to be eligible for a lot more cost sharing than I would be if I estimated at 21,871. So that's why I find this chart to be helpful, because $1 difference can be thousands of dollars of cost sharing. So it's important to understand where those margins are. But just to be clear, this chart is broken up specific to the cost sharing reductions. So if we're a household of one, 100 to 150% of the federal poverty level is where someone is eligible for cost sharing reductions of 94%, versus 29,161 to 36,450 is where someone is eligible for cost sharings of 73%. So I'll refer back to that in just a minute. So logic to keep in mind with the metal tiers is, the idea is the higher the premium, the more the insurance pays up front, essentially, which is what cost sharing is. Cost sharing is kind of the split between the client, the user, and the health insurance company. And for example, a plan with an actuarial value of 90%, which is what a platinum plan is, means that the insurance company is responsible for 90% of the costs, but again, as dictated by the plan's design, and the client is responsible for 10%. Now, this math is all very theoretical, is the issue, and it becomes, I think, especially important to be aware of when it comes to silver plans. So usually, if I was someone with a high amount of income, if I was above 250% of the federal poverty level, when I look at silver plans, I'm going to see silver plans with a 70% actuarial value. That's it. However, pivoting back to our graph from earlier, people in this income threshold, so people between 100 to 250% of the federal poverty level, get either 94, 87, or 73% actuarial value. I feel like my mouth does something funny when I say that. It's just hard to say actuarial. So in this respect, if we're looking at the column on the far right, 73% is just a little bit more value than a regular silver plan. which is 70%. But 87%, if we're looking in the middle pink column, is quite a bit more value. Yes. And then, of course, 94%, that's more than a platinum plan. Yes. So there's some real advantages here. They're getting they're buying a silver plan, they're paying a silver price, a silver premium, but receiving a actuarial value of a platinum and nearly a gold plan, if that makes any sense. See that? I should have done that earlier. Apologies. Okay, and just to pivot back the standardized plan chart from earlier, what you can see, and this is why I'm so excited about the existence of these charts, is they will give you guys this information. This is available information on the standardized plans in virtually all states, except for, of course, Delaware, Louisiana, and Oregon, but all other states. So you guys just have this on hand. You don't have to build these aggressive, excessive plan overview charts. The standardized plan parameters will give you this information. So we can see now, if I'm dealing with somebody whose income puts them eligible for either the standard silver or the silver at 73% cost sharing, these are individuals who might want to take a look at a gold plan, okay? They're not eligible, the standard silver individuals are not eligible for any additional cost sharing reductions. The silver 73% are, but it is only 3%. So we can compare the deductible on the 73% cost sharing, which is, what is it, $5,700, to the gold. If I want a deductible of $1,500, yeah, gold is going to make sense compared to that silver, the 73%. That's a significant difference. Now, conversely, if we take a look at the 87% cost sharing and 94% cost sharing, we can take a look at how the deductible compares in those two plans to how they compare to gold and platinum. So this becomes kind of this is up to the client ultimately, but you have now such good information with which to help them, right? Every client's going to want to see gold plans just because gold sounds better, right? Everybody wants gold and platinum things. But here, we're able to actually compare what the deductible, what the out-of-pocket is. So the out-of-pocket for the 94% silver is less than the platinum out-of-pocket. That's beautiful. Why would someone want to pay a platinum plan price for a much higher out-of-pocket max, right? Logically, it doesn't make sense. Now, if we look down a little further, the platinum plan does have co-pays for emergency room services, whereas the silver plan does not. So there is some shopping to, in theory, be done. But if we're looking at the plans as simply as what the value is, and you can see that the values are even laid out at the top, you can really see that probably people eligible for that 87 or 94% cost sharing, it probably doesn't make a ton of financial sense for them to look at gold or platinum, but ultimately, of course, that's their decision. Just a quick reminder of where the layout of things are. Of course, the health plan type and that easy pricing label, they're up at the top right under the name of the plan. And then, of course, that list of the different co-pays and co-insurance is hidden under that you pay section. But the part really to pay attention to, especially for what I'm going to briefly talk about next, is the plan details section, which is where the provider directory, the formulary, which is the medication list, and the summary of benefits and coverage is hidden away. So very important if you're looking at those items. And I had mentioned earlier that more and more HMOs are appearing to kind of function almost as EPOs, where they don't require clients have a referral to see a specialist. I'm going to show you guys briefly where to check. You want to pull open the summary of benefits for a given plan, which is, of course, right in that corner. And then you want to go to the very first page. It's usually going to be the last line item, this important questions chart. that makes up usually the first page or maybe the first page and a quarter of each summary of benefits. But there is a question. And for HMOs, this is what you're looking for. Do you need a referral to see a specialist? And you'll note that this HMO says no, you can see the specialist you choose without a referral. So this is where to finally kind of double check whether that HMO is a regular HMO or one of these newfangled, you can do it without referral HMOs. Okay, so I'm going to move right along. I want to make sure we get through everything. We're going to talk a little bit now about networks, which I think is probably one of the biggest challenging pieces of this whole thing. And I think that the trick here is this is where really assisters have to become kind of detectives. But the better equipped you are, I think the better of a detective you'll be. So I always like to think about plan selection as a kind of balancing act between, firstly, cost, which of course comes down to the design of the plan, cost sharing reductions, but also the premium, right? What is the actual cost to have the darn thing? Because care doesn't matter if you can't afford it. And that's what our plan education focused on, was how does this work financially? But the second very important part, the balancing part that we really need, is going to be care, coming down to the network of providers in which clients can use their plans. And that is very important clients understand. So I have for some time now kind of encouraged assisters and assister entities to build their own networks so they're not constantly having to look up the same information over and over. And I was going to share an example of one shared with me by the Milwaukee Coalition that in this kind of, it kind of makes me mad how good this is, because the one I used to build did not look this nice, but this is a really, really thorough, thoughtful, and useful chart. I don't think that anyone needs their chart to be this beautiful. I think especially when you get started, who cares? Mine was a scrap of paper hidden in a notebook somewhere. But this is such a good example of what an important resource this can be, because when it comes down to plan selection, helping a client understand where they can go, I think, is your most important prerogative. Yeah. Helping them kind of feel secure in the fact that even if she doesn't know exactly where to go, right? This mother of three that you've assisted for several hours knows that there are options. And that's what I like most about this chart, is even though there are X's and there are checks, it says options. It shows me information. It shows me places to go. And maybe it's not the hospital I want, but hey, there's somewhere to go. I like that. So one thing I think can be a little difficult is when it comes to the healthcare.gov, and I looked at other provider tools on different state-based exchanges, and the trick is really that they're pulling information in to healthcare.gov or whatever website your state-based exchange uses from a provider directory. So it's like a secondary source. Hearsay technology. I can't even describe what it is, because it's very, very challenging to get it right. And the fact of the matter is, a provider directory and a network of providers relies very strongly on the biggest challenge to this whole mix, which is humans. Humans make mistakes. And a lot of mistakes get made when it comes to provider directories. And it's really no single entity or individual's fault. It is just the matter of the fact that doctors change their roles, or a clinic changes how they bill. And so it's important to be a little flexible and not to worry when you can't find someone or something, but rather to try and figure out why can't you find them. And sometimes to get into the spirit of this investigation. Because honestly, this sounds like I'm lying. I sound like one of these teachers telling you how fun it is to read or whatever, but it can be fun. It really can be fun to kind of crack, where is this provider and what's going on? So a couple of places where you can locate or access the provider directory that healthcare.gov has, and I shouldn't call it provider directory, let's say lookup tool. It's going to appear kind of immediately up top, but it's also going to appear within the filter itself. And then finally, if you're looking at an individual plan, you can add doctor, facility, add prescription drugs. So this will actually add it to all plans technically, and not just the plan through which you look it up, as it were. But through any of those routes, if you take them, it will pull you back to this tool, which is usually a step within the enrollment checklist. I cannot stress this enough. I would highly recommend waiting to put any information in this until after you have done your plan education. I would not do this first. I would come back to it. So even though it is unfortunately part of the enrollment checklist, it's something you can always access later on. So sometimes an idea is we're going to look at plans first, and then let's go ahead and start thinking about talking about those doctors, just because you'll find clients want to tell you 45 doctors at this screen, and that's often a poor approach for this tool. So to start with, I would advise not using this tool for prescription drugs. It will give you an X or a check as to whether the drug is covered. The problem, it's not very good about indicating whether it's the generic or whether it's the brand or whether it's some kind of step therapy necessitated medication in between, because the way you look up medications doesn't necessarily compute to how it's displayed when it comes to each of those individual plans. The other problem, getting medications covered is not hard. A doctor can probably do that for a client if, let's say, it turns out their medication is not in the formulary of the plan they signed up for. It's actually not, I'm not recommending this, but it's doable. What's hard is how expensive medications are. And the medication prescription drug lookup will not give you that information. You actually will have to do a whole separate step going into the individual plan's formulary and looking at that medication, figuring out how the medication is tiered and comparing it to the formulary. Do not use this for prescription drugs, because it will give you maybe a quarter of the information you need and probably will make more work for you. Now, secondarily, I would say when it comes to the doctors and facilities lookup tool, I would say it works decently well for facilities, in which I include hospitals. I would say to be very careful with individual providers for a variety of reasons. But I would probably encourage you to first of all, always double check the information here against the actual plan provider directory. Do not assume that it's giving you 100% accurate information unless you can confirm it through some secondary source. So essentially here was me doing some research, I think again in Wisconsin. But when you try and pull up the name, and of course, all the names of certain medical groups and hospitals, they're becoming more and more similar. But you'll get this lengthy list. Let's say you select the correct one. And then in theory, with each plan, it will give you that check mark or that X. And again, could be correct, usually pretty good with hospitals and facilities, but you want to check that elsewhere. Another example I wanted to pull up where I use this the most with hospitals, I would say, when I'm doing enrollment. And this was another hospital, again, I want to say Miami, but something that happens is after you search the name of the hospital, you'll get a list of different hospitals with that same name, and you'll be encouraged to add one so that the tool can check that one. My recommendation here, just because there will be so many different hospitals with the same name within the same area, right? Because a hospital will have so many different types of facilities within itself. You want to, if possible, select general acute care as much as possible. Or another tip, if general acute care doesn't turn up, cardiology is sometimes very effective, okay? I wanted to kind of give an example of what I like to do as much as possible is try and break provider tools. And so I found a physician who's practiced for quite some time in this very small town in Wisconsin called Spooner is the name of the town. And I wanted to see how effectively healthcare.gov, but also all the provider directories for this particular small town. There are only 4 insurance companies in this area, so it wasn't like a huge amount of work. But I wanted to see how hard it was to come up with this person. So this lady's name, she has a 3-name name, which is always with this type of directory kind of a problem. They're sort of using usually the last name and then confirming it against a first initial. So already there's kind of this question mark as to, is this name going to cause issues? So I started with the individual provider, which I advise you guys not to do on healthcare.gov. And what you guys can see is, no, this person does not come up at all, interestingly. So I tried again. I tried to last name, comma, first name. I've discovered since that the healthcare.gov lookup tool does not function better with that. Just do first and last, don't do title. Try to avoid middle names, but how would you know if a doctor's name is their middle name and not part of their last name? It's very complicated. But as much as possible, a first name, a last name in that order tends to be the way to go. So still not finding this person. So I searched this doctor and I started to kind of realize, I think I know what the issue was, which I'm all excited about in my head as I go. And the issue might simply be connected to how her clinic is billing. So I went back to the provider directories. Uh-oh. No, I searched her again. No, I couldn't find her anywhere. It was making me crazy. So again, as an individual physician, she does not exist as far as healthcare.gov is concerned, which she certainly does. I know, I know that she exists. I tried so I tried the middle name as the last name, no dice. So then I went into one of the health insurance company's provider directories that I knew had her network for a whole different reason. I actually tried the other 3 as well, and it doesn't matter. One thing I want to call attention to is when these directories have these categories, that can be such a helpful thing for a client. Sometimes a client is just naming a doctor because they want to have a name. And in fact, often it's more important, maybe they're not going to stay with that doctor. Maybe they're just naming the person who they've had for a long time, even though they plan to switch to someone else and they just don't know who's available. It can be such a helpful thing to actually show a client that they can look up providers by a specific specialty, that you could show them, here's how many PCPs in your area accept this insurance and are accepting new patients. So just a reminder there that sometimes these categories within a provider directory are such a godsend. Sometimes we don't need to find the one person. We need to show a client the availability of people generally. So here I am in Medica, which is one of the health insurance companies, QHP providers in this area of Wisconsin. And I again search for her and I get nothing, which was really distressing because I knew she was for sure in network, but I cannot find her. So now I've noticed this Essentia Health. I don't know if you guys can see it, but a little bit to the right, there's this colorful thing. And I'm like, that's not a health insurance company. So I looked up the clinic and I was able to figure out that, yes, this clinic is absolutely in network with Medica, and she is absolutely a provider at this clinic. From there, I circled back, found the clinic in healthcare.gov, which tends to be a lot easier to find an actual facility, a name of that provider, and added that specific clinic to my search. I always forget I can do this until I'm knee deep in one of my investigative projects. And I added her, and I added that clinic, Essentia, and then I did a search for plans that had Essentia in network. And there it is. And Medica was there. So it was like the silliest, most ridiculous, most laborious way of backwards engineering something I knew to be true. But the intention here is to just make sure you guys know, if you're struggling with a provider directory or if you're struggling with healthcare.gov's lookup tool, it is not you. It is because how this stuff is set up, how a contract with an insurance company, an individual clinic, whether the name of the doctor, the name of the clinic, it's all invisible information, and you're having to essentially work it out backwards and in high heels, like what's her butt who danced with Rogers. It doesn't matter. So this, I think, is hopefully an illustration of that. And again, get assistance from your networks if you're hitting a point where there is a network adequacy issue. If you're seeing there aren't enough providers for a certain plan, plans must have providers. I should have clicked that earlier. Okay.
Thank you, Ari, for the great presentation. Very informative and very helpful. And to follow up with that, we have a couple of questions for you. So the first one is in reference to slide 7 through 8 on the new healthcare.gov display plan. So the question is, the deductible is $3,500, but will there be more deductible costs added to this amount?
It's hard for me to say for sure because I can't actually access the summary of benefits, but I want to say no. I want to say, from what I remember looking at that plan, the 35 is, it does, part of that is a drug deductible and part of that is other services. It's not.
And it's not?
It's not higher, is my recollection.
Okay. And next question is, as HMOs become more like EPOs, what are the differences between these two?
Really, this is a question that I myself have been trying to figure out what the difference is, because I've been saying it for a while. It's basically an EPO. And I want to really look into it and make sure I don't give the answer wrong. But my understanding is always, does it require you to have a primary care provider, which is something that we've seen shift in many respects, right? Some HMOs have more leeway with that, and some HMOs don't. But then again, the referral part is probably the most important piece. So I think we're going to just see more and more versatility with it. But yeah, I don't think there's much of a difference beyond those two categories. But I'm sure there is something that I don't know about deep down in a contract somewhere. But to my mind, if those things continue to just shift in the direction they have been, they will be the same plan type.
Yeah. Thank you. And of course, we will respond to questions we don't get to live via our Beyond the Basics email, or of course, reaching out to Ari. Here are the resources that were shown in today's slide deck, and this will be on our Beyond the Basics website. And this is Arianna's contact information to reach out to her for any questions. And Arianna, you're getting a lot of praise in the Q&A chat, so maybe you'll be seeing some of that. And as a reminder, we will be distributing the materials from today's session via email. We've got another webinar right around the corner with renewals and redetermination process on healthcare.gov this Thursday, October 12th at 2 p.m. You can register for this and other upcoming webinars on the Beyond the Basics website under upcoming webinars. So with that, we thank you again for joining us today.